This is the assessment that you're going to learn to do on your patient. It's a head-to-toe assessment. And we have a patient named Pat today here in the emergency room. And Patty is going to take care of him.
Hello, I'm Patty. I'm your nurse today.
Hi, Patty.
How are you feeling?
Oh, kind of crummy.
Can you state your name and date of birth for me?
I'm Pat Jones, January 24th, 1952.
Just double check your bracelet here and make sure we got you. We do. All right, Pat, what brought you into the emergency room today?
I have terrible cramps in my stomach.
Okay. Anything else going on?
I've had a lot of nausea and vomiting.
Okay. How long have you had the nausea and vomiting?
Just this last night.
Okay. Have you checked your temperature or anything? Any fever?
No, I haven't had a fever.
Okay. All right. Well, what I'd like to do is a physical assessment and get some baseline information, and I'll go ahead and do a total physical assessment on you today so that we have everything that we need. And I will be documenting that, and just so that you're aware when we do assessments like this in the physical, if there's anything unusual, then we report that to your healthcare provider. Otherwise, we do document our findings, but those are kept confidential.
I just want to feel better.
Okay. All right. Let me get your vital signs first off, and we'll kind of go from there.
Meanwhile, the nurse will have gathered her equipment and perform hand hygiene. Of course, provides for client privacy. She will take my vital signs and ask me if I have any pain.
All right, Pat, it looks like you're running a little bit of a temp here. About 38.2.
The nurse will also inquire about the client's history related to each system assessed.
Okay. Your blood pressure's all right.
I'm feeling weak.
How would you rate your pain right now?
Oh, about a 6, maybe a 7.
Okay, and that's in your abdomen, and it's crampy.
Very much so.
Does it radiate anywhere else?
No, just my abdomen.
Okay. Well, I'm going to assess your abdomen as we go through your physical assessment, and maybe help pinpoint where exactly that pain is at that time. Okay. So I've got your vital signs.
Now, if the client displays difficulty speaking, use one of the following to point to common objects and ask the client to name them. Or you can ask the client to respond to simple verbal or written commands. Listen for lapses in memory. Ask the client about difficulty with their memory. Test their immediate recall, recent memory, and remove memory if lapses were apparent.
Okay, Pat, can you tell me the date?
Today is February 27th.
Okay, and what day of the week is it?
It is Thursday,
Okay, and what year is it?
2014.
Okay, do you know where you're at? Can you tell me where you're at?
Casper College Hospital,
Okay, do you know what part of the hospital you're in?
in the emergency room.
Okay, very good, thank you.
You're welcome. She's already said why she's in to see the healthcare provider today.
Okay, Pat, what I'm going to do is we'll kind of start with your head and go from head to toe with the general assessment. Do you have any problems with your head at all? Any problems with headaches, any history of epilepsy or anything like that?
Migraine.
Okay. And how often do you get migraines?
Usually maybe once a month, depending on what I eat.
Okay. I'm going to put the bed down here a little bit so I can reach you a little better. Any history of any head trauma at any time?
No.
Okay. I'm just going to look at your head here, just going to look at your hair, the texture of your hair, make sure everything is symmetrical. And that does, your head looks good. I want to check your eyes and your ears as well. I'm going to go ahead and check your eyes first. Lights down here a little bit. Okay, if you can, just look straight ahead for a little bit. I'm going to shine a light here at the edge of your eye. Okay, and I'm going to do this other side. Okay, very good. I'm going to sit you up just a little bit. Is that okay?
Yeah, that's okay.
What I want you to do now is I want you to go ahead and look at the tip of my pin light here. And now I want you to look over there in the at the edge of the glass. Okay, if you could do that again for me. Look right here and back there. Okay, very good. Now I want you to focus here one more time and keep your eyes on it while I bring it close to you. Okay, very good, thank you.
My nurse will also check for symmetry of facial movements by asking me to smile, pucker my cheeks, and puff them out.
Okay, Pat, gonna have you I want to check some of your cranial nerves and your facial muscles. Can you smile for me? Very good. Puff your cheeks out. Like that. Very good. Thank you. That all looks symmetrical. Now I want to check your nose here. Any problems with your nose? Any nasal surgery or anything like that?
I once had my septum corrected.
Okay. As far as you know, though, you can breathe through both sides of your nose now?
Oh, I think so.
Okay.
I smell pretty good.
Okay. All right. I don't see any problems with that. Next, what I'd like to have you do is go ahead and open your mouth for me. And I just want to check for moisture in your mouth and make sure there's no lesions or problems with any teeth or anything, any problems with dental problems that you know of?
No. I got all my teeth.
Okay. All right. How is your hearing? Are you aware of any hearing loss at all?
I don't think so.
Okay. What I'd like to do is go ahead and have you close your eyes for me. And I want you to cover your left ear with your left hand. And then I want you to tell me what, if anything, you can hear from your right ear.
I hear it ticking.
Okay, very good. Now if you could do the same thing, cover your right ear with your right hand. And tell me if you can hear what you hear out of your left ear.
Same thing, ticking.
Okay, very good, thank you. Just going to inspect your ear a little bit here with my pin light, see if the ear canal and everything looks all right. All right, that looks good. Any abrasions or anything on the back of your ear? None are there. The other side here. Okay, that looks good. What about your neck? Any problems with your neck at all?
No.
Okay, very good. What I'd like to do is have you turn this way just a little bit. Just going to palpate a little bit here, do a little percussion. Do you have any pain in your sinuses at all?
Not today, but I get a lot of sinus infections.
You do sometimes? Okay. Don't see any swelling or anything like that. Everything looks symmetrical. Okay, moving on down to your neck here. Everything looks symmetrical there. Just going to very gently kind of palpate some lymph nodes in here. Any pain in here?
No.
Okay. I'm going to palpate the carotid pulse on this side. That's good. Palpate it on this side. Okay, very good. Just going to take a listen and see if I hear anything above that artery here. All right.
My nurse is also going to assess my neck muscle strength by asking me to shrug my shoulders against the resistance of her hand.
Okay, Pat, I want you to try to shrug your shoulders. Okay, very good. And I also kind of want to test the muscle strength of the muscles right here in your neck. If you can kind of try to push your head this way while I try to block that for you.
Okay.
All right, very good. Other side. All right, that's very good. Okay, everything in your neck looks okay, I believe.
You can also ask me to move my chin to the chest.
I want to kind of check the range of motion in your neck, Pat. So if you could move your chin to your chest like this. Okay, very good. Then move your head from side to side like this. Very good. And tip your head way back. All right. Excellent.
And this is a great time to check for the tracheal deviation.
Okay, I don't see any jugular distension there. I don't feel any tracheal deviation, so all of that looks good.
And while she's there, she can check for skin trigger by pushing over the clavicle.
Okay, Pat, I'm going to kind of get your gown undone here a little bit. How are you doing? Are you feeling all right?
I'm still cramping.
Okay.
My nurse is going to continue to assess my skin. She's going to inspect, palpate, and describe any skin lesions. Of course, you'd be using gloves if there's any open or draining lesions.
Pat,
Palpate them.
how have you been drinking?
No.
Okay, well you look, well your skin turgor's a little sticky here. It looks like you probably need to try to drink a little more. Does it upset your stomach when you drink?
Oh, yeah.
Okay. Well, we may need to help you with your fluids a little bit here. Sorry, I'm gonna kind of pull on your gown here some. Do you have any problems with your skin anywhere that you're aware of on your body?
No, not at the moment.
Okay. All right.
I have a little eczema from time to time.
Okay.
She's going to be looking at me for the presence of bruises, breakdown, any redness, scars. She's also going to
Okay.
assess my moisture.
Your skin feels kind of warm. Are you chilling at all with that temp? You've got a little bit of a temp.
A little bit. I get hot and cold.
Okay. Are you okay right now?
Yeah, I'm okay.
Okay. Just gonna feel your pulse here. This side, I'm gonna check your fingers and your fingernails here. I just wanna see what color they are and if there's any unusual shape to those. We'll do the same thing on the other side. Compare pulses here. Check your fingernails here. Look for any bruising or any dry skin or anything. And your skin just feels kind of hot and dry. Okay, next what I'm gonna do is go ahead and listen and check your chest. I'll be checking out your lungs as well as your heart. And the first thing I want to do is just check and see if you're breathing with any difficulty and you don't seem to be having any trouble breathing. Do you feel short of breath at all?
No.
Okay. Do you have any history of any lung or heart problems?
Not that I know of.
Okay. Very good. I'm just gonna kind of palpate here. See if I can feel your heart through your chest. Really not, so that's good.
So this is number 35, where she is palpating the precordium for the presence of abnormal pulsations, lifts, or seeds.
Okay. I'm going to put your head down just a little bit and then I'll put it back up in just a minute, okay?
Okay.
I'm going to be listening to your lungs and your heart right now. We'll start with your heart first on this side.
My nurse, Patty, is going to listen to the aortic, pulmonic, tricuspid, and apical, using both the diaphragm and the valve. And she will do this again with me in the upright position.
Okay. I want you to take some nice deep breaths through your mouth for me now. I'll listen to your lungs. Okay, now I'm going to set you up. Now listen to your heart again. Okay. Now, Pat, if you can, I'd like you to sit up a little bit so I can listen to the back side of your heart and your chest. And Pat, is too heavy for me to do that on my own. However, when you do this in the lab for the checkoff, there will be someone there to help you lift the mannequin so that you can listen to the back.
And you can refer to your PowerPoint, the direction that you go with your stethoscope in a zigzag fashion.
Okay. Okay, next I'm going to kind of focus here on your abdomen. And when did you said the nausea and vomiting started last evening, is that correct?
Yes,
Did the pain start then also?
gradually.
Okay. Have you had any diarrhea or any problems with that? When was your last bowel movement?
I had a real loose one this morning.
Okay. And when did you last eat anything?
Yesterday afternoon.
Okay. And what about drink? When you remember when you last drank anything?
About the same time.
Okay. Okay, what I'd like to do is just listen for bowel sounds, and I will listen over each quadrant. Go ahead and put your supine here.
While my nurse was examining my chest, she also was inspecting my breast area, looking for discoloration, hyperpigmentation, retraction, or kindling. Also, that was a good time for her to teach me about self-breast exam.
Okay, Pat, I'm gonna push gently here on your stomach, and I want you to tell me if it hurts anywhere more than somewhere else.
Okay.
About in here.
No, it's more lower.
Okay. In here.
It kind of radiates over to my right side.
Okay.
That sucks when I ate.
Does it hurt in here?
Oh, yeah.
Okay. Do you notice, does it radiate at all to your back?
It does.
Okay. While I had the patient sitting up and listening to the back, I would also be checking the spine to make sure that it was in alignment, and also looking down the back to just look for symmetry and any skin lesions or anything like that. All right. Well, it seems like your pain is kind of focused here on your right lower quadrant, so I will make a note of that. Want me to put your head back up a little bit? Is it more comfortable that way?
Yeah, a little bit. I'm a little better.
Just gonna make
While she
it.
was there, she also calculated the area above my pubic symphysis and asked if I had a history of any urinary tract infections. She's writing down all her findings so far.
Okay, Pat, I didn't really notice any real distension of your abdomen. So, I'm not gonna measure that, but if it were real distended, I would. Next, what I'd like to do is go ahead and, kind of check your extremities here. Have you had any problems with any of your joints, any, or muscles, any issues with, movement or walking, strength, anything like that?
No, pretty good.
Okay, no problems with arthritis or anything?
Only when it's really cold.
Okay, all right. What I'd like to do is kind of check the strength in your lower extremities. What I want you to do is kind of push against me while I try to flex your legs here. Okay, that's
I
good.
can do that.
And I want you to grip both of my hands as tight as you can, and I'm going to try to pull away, and I want you to try to not let me.
Okay.
Okay. That's very good. If you can, with your hand, I would like for you to touch your thumb to each finger
Okay.
and do that as fast as you can for a few times. Okay, very good. Then what I'd like for you to do with your legs here is I'd like for you to take your heel and just run it along your shin.
I can do that.
Okay. Very good, thanks. I'm going to take your socks off here. I want to just look at your feet. I want to look at your nails, and I want to look at your heels and make sure there's not any skin breakdown there. Right. And then I want to check some pedal pulses and check them for symmetry and make sure I'm feeling them equally on both sides. Okay, very good. Can you flex your feet for me? Take a look at your calves here. Look for any swelling or redness. Do you have any history of blood clots or anything like that?
No.
Okay. Do you have any problems at all? Do you feel like emptying your bladder ever, or do you feel like you empty your bladder pretty well?
Oh, I go to the bathroom perfectly fine.
Okay. Do you ever have any problems holding your urine? Do you have any incontinence issues at all?
No, not at all.
Okay.
This would be a good time for the nurse to assess my pain sensation. My feet are very exposed.
What I'd like to do now, Pat, is just kind of do some neurological checks on you, and I'm going to put different things against your skin. One's going to be really soft. One's going to be firmer. To begin with, I just want you to tell me yes whenever you, go ahead and close your eyes and just tell me yes whenever you feel something soft against your skin. I'm not going to necessarily tell you where I'm going to put this against your skin. Can you tell me where that was, the sharp?
Oh, on my left hand.
Okay. And I'm kind of going to do this over around different places too. Just tell me where you feel it.
My thigh. My arm. My wrist. My hand. My arm.
Okay, very good, thank you.
You're welcome. The nurse can also assess the capillary refill, both of the upper and lower extremity. Sufficient will be less than 3-second capillary refill.
Okay, Pat, I just want to check and see how your circulation is here in your feet. Just going to pinch your toe here for a second. All right, that's very good.
Now, Pat has asked me if I had any problems with my joints, but he can also assess it. Of course, you're always going to compare upper and lower, left side to right side. She looked at my leg veins for signs of phlebitis. She's been inspecting my calves for redness, swelling over the vein side. She assessed me for edema. She noted the location, the temperature, the shape, and the degree to which the skin remains indented or pitted when she pressed down with her fingers. She tested my gross motor function and balance, if I'm able to get out of bed. She performed fine motor tests for lower extremity, that heel to shin test. She tested light touch sensation on my lower extremity. She assessed my pain sensation with a broken tongue depressor on my lower extremity. She has on her gloves, and so now she can inspect my inguinal lymph node.
Okay, Pat, I just want to check your inguinal area down here. Have you noticed any problem, any swelling or pain in your groin area at all?
No, not at all.
Okay. And while I'm here, I would also check the pubic hair for amount, look for any parasites, look for any lesions or sores at all. And then I would have the patient roll over on her side and go ahead and inspect her buttocks and lower back for any skin problems, any bed sores or anything that I would need to document and make note of. Now, Pat, can you just about finished here, and then we'll let you get some rest and we'll get some medication for your pain and for your fever if the doctor has written orders for that at this time. Could you tell me, are there any psychological or cultural issues or needs that you have that I should be aware of?
No, not at this time.
Okay. Any spiritual needs that I need to be aware of to take better care of you?
Well, but Dana, I would like having somebody bring me to you.
Okay. All right. We'll definitely make sure that we do that. Anything else that you can think of regarding your medical history or anything else that I forgot to bring up that you can think of that I should know?
No, I think I told everything.
Okay. All right. Well, we'll try to let you get some rest and get some medication on board for you and get doctor in and get a diagnosis and hopefully get you feeling better and on the road to mend.
So throughout conversation, my nurse is going to determine if my developmental needs are met or if they are appropriate for my age. She's going to maintain safety throughout the whole assessment. She's going to observe appropriate infection prevention procedures throughout the procedure. She's going to assess the room for my safety needs, put my side rails up, give me my call light, and then she's going to perform hand hygiene. And that concludes assessment. Have a good day.